Well, hello everyone and welcome. I'm Sean Wilkinson, Associate Professor in the Department of Applied Human Sciences here at Concordia. On behalf of Wendy Coonan and the School of Health, I welcome all of you to the School of Health Colloquium series. We have two wonderful speakers today for you, Dr. Reza Farivar and Dr. Enrico Quilico. I have the pleasure of introducing Dr. Enrico Quilico, who joins us today from Dallas, Texas. He is currently completing his doctoral work at Baylor Scott & White Health. Some of you may be familiar with Dr. Quilico's work, but for those of you who are not, he completed his Ph.D. in Rehabilitation Sciences Institute at the University of Toronto and the Center for Interdisciplinary Research in Rehabilitation of Greater Montreal, where his research focused on the co-creation, implementation, and evaluation of a community-based, peer-led physical activity program for adults with moderate to severe TBI, which was supported by the Social Sciences and Humanities Research Council of Canada. Dr. Quilico obtained a graduate degree in adapted physical activity from McGill University and an undergraduate degree in education from Concordia University. He has been working as an advocate for TBI awareness since 2008 and was recognized for his contributions as a global hero in 2020, the winner of the 2019 Shirk Storyteller Competition and the 2018 Changemaker Awardee by the Neurological Health Charities of Canada. Dr. Quilico will speak for the next 20 to 25 minutes, and then if you have questions, you can place those into the Q&A feature that you see located here at the bottom of the webinar, after which Dr. Reza Farivar will speak, and you can upload those questions into the same Q&A function. So without further delay, Dr. Quilico, the floor is yours.
Thank you. It is such a pleasure to be speaking at the School of Health. I'm going to share my screen now so that I can begin the presentation. Excellent. So today I'm going to be speaking about health behavior changes for health-related outcomes. As Dr. Wilkinson mentioned, I'm currently doing a postdoctoral fellowship at Baylor Scott & White Health down in Dallas, Texas. And I'm also, I just signed on as an adjunct professor teaching some courses at the University of North Texas in the kinesiology, health promotion, and recreation department. I'll get right into it. Traumatic brain injury is a leading cause of death and disability around the world, with chronic and degenerating health problems that can persist for a lifetime. And this is more pronounced for moderate to severe cases of traumatic brain injury. Cognitive problems are truly hallmark after moderate to severe TBI, along with many psychiatric disorders like major depression disorder, which is elevated after TBI, irrespective of injury severity. The social impact of traumatic brain injury is further compounded by the variety of injury-related problems that prevent individuals from returning to a pre-injury way of functioning. This is a major societal problem. One proposed method of improving outcomes after traumatic brain injury is through physical exercise. And exercise has been shown to contribute positively toward both cognitive functioning and mood after TBI. Yet despite a lot of these benefits, this research area is still in its infancy, and there is a lot more need for studies to understand the specific application of exercise for its use in rehabilitation and how it can contribute to improving long-term outcomes. Around this time, around the time of my master's research, a lot of work had been done examining physical activity barriers and experiences for people with moderate to severe traumatic brain injury. But this work was primarily done in the clinical setting, in rehabilitation or the final phases of rehabilitation, or soon after the injury. Now, this is relevant because it doesn't necessarily reflect the reality of the kinds of barriers and experiences that a lot of people are facing in a community context outside of a clinical setting. So when all the bells and whistles are off and people are left to their own devices to engage and do exercise or engage in this kind of activity in order to reap the kind of benefits that are associated. So this is really where my master's research filled the small gap in the literature. And essentially, the purpose of this interpretative phenomenological analysis, which is an in-depth qualitative study was to explore the experiences of 7 adults with moderate to severe traumatic brain injury who had all had their injuries 5 to 31 years after, like when I met with them and carried out these interviews and we did this study, they had all had their injuries 5 to 31 years previous to that point in time. And they were all living in the community. Now, this type of methodology really supports the ways in which a researcher can interpret how participants interpret their own experiences of a particular phenomenon, in this case, a shared phenomenon. And that was exactly exercise after brain injury and experience with exercise in the community. 3 primary themes were developed. The first about the impact and personal development that occurred in the different participants' lives after their injuries and the way they had to accept themselves, and a development that was almost positive that resulted, which was really interesting finding, along with just a slew of facilitators and barriers to exercise in the community that were really specific to the nature of the kind of issues they might face in relation to their brain injuries or whatnot. And it was really strongly recommended by participants, and one in particular who explained that it is just essential at this time that there needs to be more support to help individuals at the final phases of rehab to learn how to continue engaging in exercise after their injuries, because they can't imagine all the benefits that are possible. And then one of the most exciting findings, in my opinion, was the ways in which the people discussed how exercise can be used and to manage just about all their TBI-related impairments, and just explaining to no end how it must be encouraged, because people can't imagine all the benefits that are possible and obtainable from exercise after brain injury. So really exciting stuff, and it laid the groundwork from everything was to come. We identified these biopsychosocial impacts of exercise for this population, optimal environments to support that kind of activity, and specifically, we established a need for more community-based programs that could assist with supporting physical activities and similar health-related behaviors, and also assist with the reintegration into the community, really bridge that gap after rehabilitation. So when people move from the clinical context to more of a community context, like I was saying before. If you'd like to read more about this, the paper is published in Qualitative Research in Sport, Exercise, and Health. And it really started the journey that I'm going to now speak to you about. Because in response, we developed a pilot project in partnership with the YMCA's of Quebec and the Quebec Traumatic Brain Injury Association. And this was a dream. The idea for this program was developed or came to me in a health promotion class in my master's at McGill, and to bring this sort of thing to fruition, and in relation to a need that was established, like I said, with the previous study, relates a lot to something I'm going to discuss at the end of the presentation today, which is the importance of asking qualitative questions and how far that can take you. By the way, I just wanted to mention, I'm going to share a lot of pictures throughout this presentation. So as a disclosure, I just want everyone to know that the participants in these pictures have all provided consent to have their pictures taken and shared. So we have signed consent for all those photos, which I think is a very important part of sharing photos in this kind of format. So that pilot project, which was and I'll speak to it in more detail in a second, but that pilot project really lay the groundwork for us obtaining federal funding that went on to support my PhD, which focused on co-creating, implementing, and evaluating a community-based peer-run physical activity program to enhance exercise and sport participation for this population. I got to work with an incredible team of collaborators throughout my PhD, including Dr. Wilkinson, people from University of Montreal, people from University of Toronto, where I was a student at the time, people from McGill as well, where I did my master's. So there's Dr. Shane Sweet and Dr. Lindsay Duncan. And we had support from the Social Sciences and Humanities Research Council of Canada, as well as Inclusive Society, Sport Canada. We had these incredible community partners, the YMCA's of Quebec, the Quebec TBI Association, and the Association of Quebec for Leisure for People with Disabilities. So just tremendous initiative. And I said that I was going to speak a little bit more in detail about the program itself. I use this visual to really kind of more globally represent all the work that went in and around the program that was running in the community. So the study, the research that accompanied this program, and the program that was actually running in the community itself. So the initiative, like I said, the pilot project is that bubble to the far left. And that was a pilot project that we ran in the community for 12 months in 2017. And at the end of that pilot project, that 12-month program, we had the participants involved in an indoor YMCA triathlon, which was a fundraiser for the YMCA. And an opportunity for individuals to participate in the kind of intended outcomes of the program. The second study, or around that time, we also began a scoping review, which I'll speak to shortly after this slide. And then we went on to develop the second iteration of the program in 2018, which was more of a community-based pilot research project. At this point, we had the funding from SSHRC, and we were able to expand things, and we were able to start running the research alongside the program. So the research at that time was really this exploratory case study. So if you look at the top of the second bubble, you have this exploratory case study with focus groups and individual interviews, and that was carried out at the end of the second cohort after those individuals were involved again in a YMCA triathlon and at the YMCA. And it was a tremendous event, so inclusive, so beautiful to see, really something special. Some aspects of the program that changed that year were incorporating a mentor component, whereby previous participants who wanted to stay on and give back to the program were onboarded as YMCA volunteers. We kind of divided the program into separate phases. So it was these 3 phases that focused on learning how to train safely, learning how to train more independently and autonomously, and then finally learning how to train for and participate in the sport challenge. The third cohort in 2019 was a larger cohort. We onboarded more participants. It was a larger group of individuals, and we ran an interpretive case study alongside the program with focus groups, work groups, and field notes throughout the entire process. There were some other changes in the program as well. And this year, we went beyond the doors of the YMCA, and the Community Sport Challenge was a 5-kilometer run walk marathon, Mount Royal marathon race that people did just outside of the YMCA in the community, which was really a tremendous thing to see as well. Finally, the last study I'm going to speak to in this context around the actual physical activity program was this exploration of how COVID-19 impacted the program and the way in which we really sought to find ways to support their health behaviors in the context of a pandemic and with everything that had gone on. So like I said, at the kind of initial outset around the time of the pilot study, we began this scoping review to really map and synthesize the evidence of other community-based physical activity programs for this population. And some really interesting findings that came about were like common characteristics of different kinds of physical activity programs in the community that led to improved outcomes. The need for more detailed reporting and also including sex and gender considerations into the process was an interesting finding, as well as recommendations to improve the design and implementation and evaluation of other physical activity programs in the community. So definitely relevant to everything we were doing. Should anyone wish to learn more about the scoping review that we published, it was published in Brain Injury, and I invite you to access that. I'm happy to share that with you as well. So the 2018 cohort, like I said, was an exploration, and we had a group of participants again involved at the downtown YMCA. We carried out the exploratory case study to explore the experiences of the mentors involved in the program, the participants, and the employees. We took this exploratory case study approach, and we did so through an interpretivist paradigm. We had some really interesting themes that came about related to the program impacts, the way in which, people discussed stopping their antidepressants, as a result of participating in the program. A lot of themes were codes from lower order themes that came into a larger theme called program characteristics, which discussed, the way in which, people, the aspects of the program that were leading to positive outcomes, the way in which people interacted with other members of the gym. And then another big theme that came about, and certainly in relation to keeping this program going, was about sustainability. And for instance, the way the director of the YMCA Center, spoke to the way that his beliefs about how partnering with the research community was really essential in order to validate a lot of the work being done and extend it for that matter. So we identified key components of the program, possible outcome measures for the future, and we really identified the need for taking more of a theoretically informed behavior change approach to defining the different program constructs. In this case, we went with the behavior change wheel and taking an interpersonal approach with self-determination theory. If you'd like to read more or about that particular study, it was published in Brain Injury, and I invite you to do so. It's just a quick snapshot of the publication. The next cohort, 2019, was tremendous. We expanded the program and had 20 participants. So the previous cohorts were all 12 participants. Now we were 20 participants, and we ran this participatory co-creation alongside the 9-month program to provide an interpretive account of the experiences for everyone involved across their participation and co-creating the program, okay? It was tremendous. It was tremendous. And we found themes related to program participation, themes related to the biopsychosocial benefits of being involved, and also identified the ways in which people were developing autonomy in their physical activity behaviors, and what kind of factors led to those changes that were occurring. Because we did this study over the span of 9 months, and we're running these focus groups at different time points after each phase of the program, we were really able to identify the changes that were occurring between phases and how participants were evolving. Obviously, we also identified a lot of facilitators and barriers to their participation, which were central to informing the official program manual. And a lot of those biopsychosocial outcomes, they were corroborating a lot of the findings that we had from the previous study, but also extending them because we were able to identify the different types of exercises or physical activities that people were doing, and the timing and the amount and the exposure that was leading to some of the outcomes. So really, really interesting work moving forward. If you'd like to read more about that study, it's published in Frontiers of Rehabilitation Science, and I invite you to do so. The program was a growing success. In 2017, the pilot project, we had the participants involved in the indoor triathlon. It was tremendous. The next year, they took it to another level. They were winning, they were like coming in first, second, third place in their respective ranks. They were winning medals. It was tremendous. One of the most inclusive events I've ever seen in my life at that downtown YMCA. Like I said, the following year, we extended beyond the YMCA and really went into the community. It was a tremendous event as well. The participants doing this 5K race on Mount Royal Park, just north of the YMCA. And it was a growing success year after year until, unfortunately, COVID happened and that downtown YMCA center was closed indefinitely. It's still closed to this day. And so the program was suspended. So we need to do a needs analysis in order to really explore the lived experiences of losing access to the program and determine how we could support their health behaviors in the context of a pandemic. So in this case, we used an interpretative phenomenological analysis again to really go in depth with regard to the ways in which individuals were interpreting their shared experiences. Some interesting themes that came about related to the importance of physical activity after TBI and ideas for the ways in which that could be done during the pandemic in an outdoor context. A lot of people spoke about the lasting impacts of the TBI health program, and this study was carried out during the pandemic, during COVID-19, so right in the thick of it when there were a lot of restrictions, and it was carried out over a year after the program was suspended. So people were still speaking about the impacts that were lasting that much time. There was something really interesting to be identified. And they also spoke about loss and this ability, this resilience that they had through the pandemic that was really interesting as well. So we identified how their behaviors could be maintained in this context. We identified this sense of community from the TBI health program that lasted far beyond its closure or it being suspended. And then this emphasis, this unanimous emphasis on adapting the program to an outdoor walking group context. If you'd like to know more about that study, I'd invite you to read it. It's published in Disability and Rehabilitation. A quick snapshot of the study's title, COVID-19's impact on the community-based physical activity program that I was discussing. So we responded in kind, and we decided to do a pre-post intervention to determine the feasibility and acceptability of an adapted outdoor walking group program for a number of the participants who were involved in the previous program, as well as new participants who were not. Some of the details about this outdoor walking program was that it followed a similar format, 2 days a week, 60 to 90 minutes. It increased intensity by time with periods of rest throughout the walking activities. And the idea was to also explore how this program could be a method of supporting PA and associated health benefits above and beyond the context of a pandemic. So we were able to determine that 83% of the participants completed over 75% of the sessions. We lost a couple participants to attrition, one for unrelated medical reasons due to a lot of the precautions that we were taking during COVID. That individual contracted COVID-19, but because of the precautions that we were able to mitigate the situation and ensure that the contagion was not spread to other participants. The participants involved in the program increased their daily steps by 12%. And there were no major adverse events throughout the entire running of that program. So really some very interesting findings related to the feasibility and acceptability. There were also these great qualitative findings that we did as well, because we ran some qualitative individual interviews following the end of the program that related to program resources, which included the location, people, and technology required to implement the program, its effectiveness, which included the biopsychosocial effects and usability that was perceived by the participants, and then the issues related to program delivery, including the organization, the dosage, precautions, et cetera, involved with program provision. So we identified that this kind of walking group intervention was indeed feasible and acceptable. Support for the development, implementation, and evaluation of this kind of approach beyond the context of a pandemic, and really based on the potential that this kind of application could have for people with brain injury, and also in terms of accessibility. So one of the things that I'm proudest about, and I just like to share this, is that members of that group, people who were involved, still to this day, 2 years after the walking groups were running, are still engaging in group-based physical activity and volunteer activities in their community. So as a health promotion researcher and scientist, I'm really interested in the kinds of outcomes that can relate to the work that I'm involved with on a personal level, but perhaps beyond a lot of the concrete outcomes that we look at. In terms of sustainability, this is just tremendous. I think it's really why I'm involved in this kind of work, because I'm interested in making sustainable health and positive changes in people's lives. So I decided to do a postdoctoral fellowship outside of Canada. I recently moved to Dallas, Texas. Texas. I now work with an incredible team in physical medicine and rehabilitation, and learn tremendously from a lot of their large-scale clinical research that these individuals are involved with. Dr. Simon Driver was a bit of an idol when it comes to this line of research, and the opportunity to now work with him directly and his team is really exceptional for me. One arm of their research that I'm very much involved with is related to this evidence-based group lifestyle program, and it's been tested before. It was developed at the University of Pittsburgh. It's called the Diabetes Prevention Program, which was later named the Group Lifestyle Balance Program because it took a group format instead of an individual format. I'm not going to go through the details, however, of the program, but the goal is to lose up to 5 to 7% of your weight through moderate calorie fat diet, monitoring, and increasing your physical activity to recommended amounts of like 150 minutes of moderate to vigorous physical activity a week. Now, what's really interesting is the individuals on this team, they modified the program specifically for people with brain injury. And those are two papers from brain injury that relate to how they took a participatory approach to modifying that program, one for people with TBI and two for people with stroke, acquired brain injury. Truly a tremendous, line of research that dates back 8-9 years now, with stemming from those modification studies that related to, really tailoring the program for that population, piloting the work, going on to run large randomized control trials to test the efficacy of this work. And now the study that I'm currently involved with is a large randomized trial that is looking at the efficacy of a telehealth delivered version of that program. So I invite everyone to read more about some of the efficacy trials related to the TBI program and the stroke program. They're both published in Annals of Behavioral Medicine. And I'd like to discuss some of the next steps at Baylor Scott and White that I'm involved with and really excited to be doing. I just submitted a large grant, my first grant as a principal investigator to NIDLR, the National Institute of Disability, Independent Living, and Rehabilitation Research in the US, which really focuses on bringing the TBI Health Walking Program to this Dallas-Fort Worth Metroplex area and testing its efficacy. I'm also looking to examine the feasibility and acceptability of an exercise extension to promote and sustain physical activity after participants complete the current telehealth GLB program that I'm involved with, as well as collaborating on existing and future projects to ask qualitative research questions about human experiences, perceptions, behaviors, and meanings that people attach to them. My dream would be to develop international collaborations so that I may continue this type of cutting-edge work in Canada, for instance, through the School of Health. So on that note, I want to just share, before I finish, some lessons that I've learned along the way that I think are very relevant to a lot of the work that I spoke to you about today. I know it's a lot of work, but one, the importance of asking qualitative research questions because of where it can lead you, and the importance of how it relates to identifying actual needs in the community context for people who are there. The value of partnering with communities, community organizations, stakeholders, for all the change that it can promote in people's lives, as evidenced by the number of studies that were really run in parallel alongside the community program that was running out of that downtown YMCA. The importance of adapting to unforeseen circumstances as best as you can, based on the outdoor walking group study that took a lot of work to get off the ground, because running work research during COVID is extremely difficult. But look what happened. There's a group of people who are still to this day involved with those group-based physical activity, a tremendous outcome. The importance of learning from evidence-based examples and how that relates to pushing yourself outside of your comfort zone, moving down to the southern USA and working with people that in an area that you were not as familiar with, but just based on everything that you can learn from it, and how much that contributes and develops to your future. And then building initiatives that can potentially cross borders based on my interest in continuing this line of work, and potentially from Canada. So I wanted to leave you with those ideas, and a big thank you to my supervisors, co-investigators, community partners, stakeholders, absolutely everybody along the way. The people who I'm now working with at Baylor Scott and White Health. I hope this presentation serves as a catalyst for our future work together, and I welcome all of your questions, because that is certainly my favorite part.
Thank you, Dr. Quilico, for a wonderful talk. At the moment, I don't see any questions in the Q&A. Maybe we'll take one, because I don't want to cut into Dr. Farivar's time either. So one here from Steve Henley: amazing research and findings. How do we encourage PA, not just for the TBI and TR populations, but for the overall populations? It seems obesity, sedentary lifestyle are more prevalent in Canada than the US. Is a social network part of the solution to encourage participation? And maybe if we can get a quick response to that, because again, I don't want to cut into Dr. Farivar's time here, which we're already.
Absolutely. I mean, I think that taking evidence-based examples and working with them in this way is a really successful approach. I know that everyone has their line of research and their ways about going about it, but I think truly that evidence-based examples and modifying what's out there is a great approach, and just based on some of the significant findings that are coming up with the work I'm involved with now. So. Yeah, great question. Thank you, Steve.
Excellent. Thank you. Okay, Wendy, I'll turn it over to you at the moment. Thank you.
Great. Thank you, Sean. And thank you so much, Dr. Quilico, for the wonderful presentation. And I hope everyone has a wonderful afternoon.